No, I don't think the lockdown is a good step for public health. Mainly because the only, if at all, purpose of a lockdown is to buy time to strengthen your public system so that it's not overwhelmed. Clearly, that's not happening. So, the kind of damage that's been done by the lockdown, it's not been measured, but even what is very visible to us, I think it's completely unacceptable. And there's nothing that can justify or rationalize a lockdown of this nature and the kind of consequences, like who is going to be held accountable for the immense damage that is happening now, and also it's going to continue for a long time. Even if looking at purely from a health point of view, if people have lost access to medicines, if people have therefore developed multi-drug resistance because they missed doses of the medicines which they couldn't access, if people have died or people have got first grade complications, uh, if pregnancies have not gone as they would have in other circumstances, then these are not things that we will say, it's okay, at least we, did something about COVID-19. So I would definitely think an unplanned lockdown like this is completely, there's no rational or no justification for it. And the thing that we have to keep in mind is these kind of pandemics, it's not like they'll say, oh, there was a pandemic and give people a break to set themselves up to prepare for the future. They can happen again. It can happen like even as the COVID-19 was happening, there was a cholera outbreak that was happening in Karnataka. Which is another notifiable disease, the Casino Forest disease, which is seen in pockets of Shimoga, was showing a resurgence. So there, and like in Kerala, they've seen the way the Nipah virus struck, and it kind of, except for the fact that the government dealt with it, it would have taken a huge toll. So there are these kind of diseases that are likely to happen. There are other disasters that are likely to happen, like cyclones, floods, who knows, biochemical or biological or chemical kind of attacks. Anything can happen. And apart from that, the growing other non-communicable diseases, the existing diseases that we have. So it's important that the system anticipates and prepares. I think preparedness of a public health system is very important. And we've seen that in countries where the public health systems, or even in states like Kerala, where the public health system has been prepared, you definitely see that it has not reached the kind of disastrous consequences as seen in other places. So the focus should be on preparing the health system, and I think the government really needs to be honest to look at the gaps. Even the so-called experts, I don't think just pointing fingers as the government is, of course the government is the primary responsible, but then who's been advising the government?
And in this case, especially because they decided to go with the National Calamities Act rather than the Epidemic or the Epidemiology Act, which basically would have given more power to the state governments rather than the central governments, which is of course the opposite of what has happened in this situation, where the central government is calling all the shots and the state governments are kind of scrambling to keep up with what's happening.
Yeah.
Sorry, please continue.
Yeah, and we kind of see that across the board. It's not only in terms of response to the lockdown. I think this centralization is a problem. We need to really address it, or understand how it impacts on a whole bunch of other things as well. But to understand that the public health system primary role of it being preventive is very important. What are we doing? What are the preventive measures we are taking? I think addressing that as a learning is important. And addressing social determinants is an important aspect of prevention. So you have an undernourished child who's has absolutely no ability to deal with even minor infections. You call it a vicious cycle. So every time a child becomes malnourished, they tend to fall more sick, and because they fall more sick, they become more malnourished, and the child cannot come out of that cycle. So looking at those things, like what's happening to sanitation,
Right.
and when you say lockdown and you say stay at home, and you don't look at the fact that staying at home itself is going to lead to overcrowding, which means you can't have physical distancing.
Right.
How are you going to address that? What's happening to your housing? How are you planning your housing? Is it all about real estate and building big complexes and big supermarkets and malls? Or do you look at housing that's affordable, accessible, and also in terms of meeting certain public health criteria? Like almost 70% of people live in just 1 or 2 bedroom houses. I mean, 2-room houses in India. Then how can you then go and ask for physical distancing? It's also about the quality of your air, it's the quality of water, it's what's happening to the sanitation systems. We
So
have like yeah. Sorry.
no. So are all these things then all the various factors that you've mentioned, all things that the central and state governments need to look at once the so-called lockdown period is over? Because otherwise I can't
Yes,
see, because the social determinants, like you're talking about things like, caste, gender, nutrition, these are all things that sort of determine the ability of a person or a family to sort of progress or, live a life that enables them to progress in some way at least, right?
yes. It's also about livelihood. It's and how much of the investment is on the public health system, and how much of it is on decentralizing it. Like we're talking about labs, and we're saying do testing,
Right.
but there are no labs available. So you need to invest in labs, and not just labs that test for COVID.
Right.
Because once say 50 or you get herd immunity to COVID, what are you going to do with all those systems that you set up only around COVID? It's not good planning. You have to anticipate many other possible such outbreaks or epidemics or disasters, and you need to prepare. And the only thing you can do in a pandemic like this is to learn from it. And if you let it happen again, and if you haven't therefore invested in better systems, then it's really tragic that it shows really a gap in planning and policy making if we don't learn from this and invest in future.
And a pretty much a knee-jerk reaction on the on the form of on the part of the state as well, which is how it looks to a lot of us right now. So now moving on to another thing which is slightly more personal to you, Doctor, is you often work in very trying circumstances with the odds stacked against you. I've seen comments on your tweets and articles. You tweet pretty often. You write many articles, and there's some very ignorant and hateful people out there who comment on your who either comment on your tweets or articles. Does that, and they say really vile things that no human being should say to another human being in any circumstance, let alone to a doctor who's trying to talk about issues that affect all of us. So does that ever get you down? And how do you stay focused and motivated despite things like this?
The way I see it, even those people who criticize some of the things we say are also people who don't have access to information. Just as people who suffer the adverse consequences of some decisions have no access to information. It's even these people who who react or who show anger or who rage. There's very little information that they have access to, and I've seen that there are some people who, if you engage with them, they're willing to listen, or they're at least willing to think about it, which I think is to be appreciated. And if you look at caste, the people, I've seen mostly the dominant caste people who take great umbrage and who greatly affronted by any criticism of caste because they are the primary beneficiaries. I mean, they're sitting on top of a pyramid where all the work and all the labor of the people who they have put below them is benefiting them. So they're only looking upwards and saying, hey, the world is so fine. Why are you complaining? Why are you being so cynical? But then everything, that's coming out is coming because of someone's labor, and I think people don't see that privilege that they're sitting on, and even among that group, see, like it's I've seen that the Christian institutions are a good example of how charity works. Charity makes you feel good because you sitting on top and you're distributing something, you're doing something for others. It's it's a feel good thing. And a lot of the dominant caste people are also okay with that model. They're okay being progressive, liberal, working for the poor and working for the marginalized and oppressed. It gives you a feeling of satisfaction. But then once you start talking about equality and once you start talking about justice, and you say people don't need you to speak for them, people just need the same access to the same resources that you have. Why is it that your child has such good education and the children don't have even schools? Right. Then that idea is very threatening to a lot of people, because I think it's hierarchy is very ingrained into the Indian mindset. And I think it's across religions. I don't see that this whatever this idea of caste and superior or inferiority. I don't think it's limited to Hinduism. It's seen even in Islam, and it's even seen in Christianity. And but I've seen that every time you especially on social media, every time you attack caste, they try to make it about religion, and they say, "Oh, look, it's like somebody's attacking the Hindu religion,"
right?
But it's not. It's I think the hierarchy, which is a social thing, is more of an issue. Religion is pretty much what people choose or choose not to practice. It's not something you come. I mean, you're born into a religion, and you decide whether you want to continue it or not. But caste, I think, is much more problematic than religion.
These are human beings perpetrating these things, right? Ultimately, they might be from any religion or whatever, but they're ultimately human beings perpetrating it. And the religion is a religion. It's an idea or a philosophy or whatever else on its own. How it's interpreted and how human beings are executing those things. I mean, of course, I'm not saying that you can take away certain things which certain texts or certain people who have written things based on a religion that have then been taken forward. But what I mean to say is that there are human beings taking these decisions in those moments, that are casteist in nature and that are discriminatory in nature as well. So it's something that has to, like you said, until there's an equity, not equality, but an equity where there's an equal access to the same things that all of us have access to as people of privilege. We cannot really sit here and say otherwise. It could just be people of privilege sort of feeding their savior complex or savior complexes to say that, oh, I am so great, I'm doing this. But then ultimately, what you could do is sort of pull someone else up onto the same platform that you have and let them freely use that platform, rather than you being the go-between or a middleman or middlewoman or whatever it is. So, but that, I guess, is a thing that's a deeper discussion that's, that we could probably spend days talking about, and with examples. You have, of course, seen with your own eyes and heard with your own ears how many people have been discriminated against like this. So, yeah, and just to this thing, to move on from there, should, in that case, looking at how people are, how a large section of our population is being discriminated against, should healthcare be a universal right provided by the state? And should it be a more, even there, should it be a more holistic approach to healthcare that's a universal right? So a universal healthcare that is also holistic in nature. That is my final question.
I think certain things like food and water and healthcare, education, I think these have to be universally available, and it has to be equally available or equitably available, as you say. Healthcare, definitely. I think there's enough evidence to show that people, that countries or states which have invested in universalizing the healthcare, making it comprehensive, making it decentralized, making it public, have shown better indicators, have shown better health outcomes. People are more able to access it. People don't go into like catastrophic health expenditures because of healthcare. And they also, it also like kind of focuses on the preventive aspects of healthcare, because it's like, for example, dengue.
Right.
If it's a private kind of healthcare model, they see no benefit out of preventing dengue.
Right.
It's the same with, say, tobacco or smoking. If you're going to not bring in certain restrictions on tobacco smoking, then you're not going to get the kind of what I mean to say is, preventing tobacco smoking is less lucrative than allowing it to happen. Then you get the terminal cancers, and you get the severe cases of bronchitis, or lung abscess, and all the complications of tobacco, which is good for a business model.
Right.
So a private focused healthcare would never invest in prevention.
Right. But prevention is such an important determinant of widespread healthcare, and
and definitely, and it makes even sense in terms of the budget. Would you rather, like with this COVID thing, they're saying invest in ICUs and ventilators, but there's very little talk in actually preventing it from occurring in people. So which is more economically viable? Of course, you need ventilators. Of course, you need ICUs. You need to take care of your terminally ill or your seriously ill patients. But you can't invest all your budget on that and say, okay, as many cases want to come along, that's fine. We have the systems to treat it. There's no system which can function purely on a tertiary model, and India is definitely headed that way. I think people really need to call out the government and make demands for policies that focus on prevention, and also a kind of it 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 should flow smoothly. It shouldn't be like a disjointed, a very fragmented kind of healthcare, that you get something here, this hospital, this insurance will cover your heart disease, but it won't cover the complication of your heart disease. Then you have to go somewhere else and pay. And it's becoming very fragmented, and it's burdening the patients. So the focus should be on making like right now the healthcare is very fragmented. So what happens is, you go to one hospital, you'll be covered under some health insurance scheme for a surgery, and then they'll say, but the testing before that is not covered, and the complications after that is not covered. There's a lot of cherry picking that is happening now. So hospitals pick up only those cases that are lucrative, lucrative and which don't have that many complications, like straightforward surgeries. You go, you remove a uterus, and you're out. That's hysterectomies are surgeries that people love having, because it's not a complicated, it's clean surgery. But then there are lots of people who have who have cancers, who also have leg ulcers, who also have migraines, who also have issues with the kidney. So to have a kind of a comprehensive healthcare is very important, with like a proper primary or secondary or tertiary level facility, and also the super specialty kind of facilities. It's also about putting healthcare into people's own hands. Like if you're diagnosed with a non-communicable disease, you're first given agency over the disease. You're first told what all you can do. And we've seen a lot of patients who are actually very happy to take care of their own health. They become equal partners. You tell them, cut down on this, or cut down on sugar, cut down on carbohydrates, and do this thing, make these lifestyle changes. They're ready to do it. But what tends to happen is you see patient as a business, is something to generate money out of. So then you're always wanting to do tests, and you're always wanting to treat them as a case. You always want to medicalize and commercialize illness, then it's very problematic.
So the patient as a commodity, essentially, in a sense, and where they are sort of being forced into this model of healthcare that is more based on a profit-making ability rather than a true the true definition of what healthcare is. And I guess
Yes.
you also see in places where if the population, basically, if you're preventing and you're also educating people on how to take care of themselves better, you also have a population that has a greater immunity, that has a greater ability to fight these kind of pandemics when they do occur. And therefore you have people who are also more they have more knowledge about their own health and their own bodies, and understand what they
Yes.
can as an individual, rather than it being another this one size fits all approach again is a very flawed approach in many different situations, and here as well, where an individual
Yes.
realizes what he or she can do for their own specific body, how their own specific body works, in order to be a healthier person, and therefore have less of an impact on the, or be a less of a burden on the state's healthcare system. But then, because the private sector has taken over so much, and because it's heading in that direction, the very nature of healthcare is changed, and
Yes.
you find sort of people being pushed towards
A medicalized model.
where they are spending more, where they are put under greater duress, greater stress, where, like you said, it becomes a kind of an economic catastrophe for many families. So yeah, so it's a very it's something that a lot of us as Indians need to think about, and because a lot of us, again, with our privilege, are very happy to go to a private hospital or a private doctor or a clinic and immediately get our healthcare taken care of, money be damned, just as long as we're okay. But we never think about large sections of the population and how they are accessing healthcare on a day-to-day basis.
And also, I think it's important to state that it's not necessarily that those who have health insurance or money are getting better healthcare. In
Right.
fact, you might, be warned. You might be actually being subjected to more tests, unnecessary tests, and unnecessary procedures only because you have access to money. So, having ethical, rational, evidence-based medicine is very important. Um, it's not necessarily that the rich are more protected. You have these schemes like buy one get one free, pay for one kidney surgery and get your gallbladder removed for free. That's the kind of level of commodification that healthcare has gone into.
I mean, it's almost laughable if you think about it, but
Yeah,
sadly, it's becoming
it's happening. Yeah,
it's becoming the norm,
yeah.
pretty much, I guess. So now, Doctor, have you always had this strong sense of justice always through your life, or when you were growing up as well, when you were a child, or is this something that you've picked up upon, taken on later in your life? Is it, after you became a doctor that you started seeing how the healthcare system works, and then sort of move towards this idea that, no, there is not just about me being a doctor and providing healthcare to a patient who's come to me, but there are larger issues at play here that I need to really deeply engage with and sort of see how I can bring about the change through policy and other ways.
I mean, I think I was pretty much like once you get into medicine, you think the very first day of medicine, you think you reach somewhere, and there's a lot of arrogance and a lot of a sense of superiority that comes in as soon as you get your medical, even the very first entry into medical college. And I think that kind of continues for quite some period of time, and it gets reinforced continuously. Like even when you go into the hospital as an intern and you see patients, you see them dependent, and they also treating you like it's a very powerful it's a very powerful place to be. It's so unequal. You're the person who seems to have the knowledge, and I think it's a lot of doctors go through their entire career in that same frame of mind, thinking they own all the knowledge. But I think it over time. At least I realized that people wisdom and with a lot of understanding. That is a traditional birth attendant of villages, mainly Dalit women who help, women during delivery. And it kind of gives you a whole new understanding of delivery. It's not an incident; it's a process. Like what happens before, and the fact that this lady who's there throughout,
You're
from the
talking about
beginning,
the dyes or the midwives, right?
the dais or the midwives, and you realize this medical knowledge or the curative aspect of it is such a small part of a larger kind of relationship that people have with each other. And doctors play a very important role, but then so do a lot of other people there. People come in and they bring in a lot of knowledge and a lot of wisdom into any process.
The other thing that I wanted to ask you about, and this is something that I've always admired about you, is along with being a doctor, researcher, activist, you also write very sharp fiction. These are things that I will link, on the page where we're sharing the interview. So don't worry, guys, you can check all that out. And also, you also are a very, very accomplished artist, and you illustrate social and political issues. You make comics. You do artwork, and what I'm going to do right now is, instead of just talking about it, I'm going to do a quick share screen and show you guys what I'm talking about. So this is a line drawing that Dr. Sylvia has done. She's done a lot of them. Actually, these are among my favorites from your work. I love this series of line drawings that you have done. In fact, I'm going to at some point maybe buy one of you and frame it and put it up. Could you just tell me a little bit about where this artistic side? I'm sure this is something that you had from when you were young, as a child. Is it something that you always drawing and doing things like this?
Art was definitely a way for me to express myself. The initially it was like just drawing, like I mean, just it didn't have much of a meaning initially, but I think through college and through my teenage, it kind of helped me to articulate things or emotions. It's a way of expressing uh, what I feel about the world, of my relationship with the world, and it I did explore take it up as a career. It kind of didn't work out.
I mean, it's the art world's loss. Let's just put it that way.
Yeah. But so then just this idea of doing medicine and then giving up on these things that you enjoy, it just seemed like giving up a lot. And over time, I started making cartoons related to the kind of things that I was coming up with, even in
Yeah, and
work. And I
you've been
think
seeing those.
it balances me. It helps. Yeah, it helps me to articulate. Like if I can't put it in writing, then I try to put it through illustrations. Uh, so between writing and between this art, I think it helps me also. It helps me feel that I'm responding to something, but not in a way that's like destructive to me.
That's a beautiful way to put it. And you would have seen through this whole interview, examples of Dr. Sylvia's, comics, or how she explores some very difficult issues, social issues that affect a lot of people through her work, through her artwork as well. Tell me about these line drawings, Sylvia. Are they? Is this part of a series where you? Because they all have a certain. It feels like a sort of a series. There's
Yeah.
Yeah, please tell
But
me about.
thank you for putting these up. Yeah, it looks nice on the screen.
Yeah, I'm
Yeah,
sure people are enjoying looking at them.
they were a series. I think about 10 of them. It's more like it's speaking to the person who's viewing it. So if you see the main person is looking out at the viewer.
Right.
It's they're looking at them, but in the background there's always like something bad that's happening,
Right.
which that person is not really aware of or is not really connected to. So in the backdrop, there are things happening. So it's you who has to respond, because that person isn't aware. So you're seeing a person and you're seeing something happening to that person, and it's kind of a message to you. What are you going to do about it? Like,
Right.
what do you think you can do about it? It's like a challenge almost.
Yeah.
There have been some criticism in the sense they say you always draw these very young, so-called beautiful looking women. So that has been a criticism.
That's your choice as an artist, so I won't comment on that.
Okay.
As a hetero cis male, I obviously like looking at these young beautiful women, but I don't know what other people will think. But yeah, but more than that, it's just the attention to detail, and I really love the expressions. I love the amount of detail. I love complex work. This is a personal preference. So then moving on to a kind of a different, completely different style. This is a more of a painting style, and any this thing of qualities, because it's a picture of a painting. So guys, let's not get up in arms about things looking a little pixelated or whatever. That's not what we're trying to do here. I'm trying to share the work that Dr. Sylvia has
Spoken like a true artist.
done.
You get that criticism a lot.
Yeah, I mean, of course, as photographers, we are always obsessing about these random details and fetishizing these random things unnecessarily. So instead of that, let's look at the content. This is, of course, some very beautiful work that you've done. These are, I guess, more painting. Is it with acrylic paints or oil paints? What is this? What is the medium that these are done?
I did use acrylic and oil. So I think one of them is acrylic and one of them is. I mean, yeah, I try not to be boring and therefore try different mediums. Yeah.
Yeah. So you see
one style.
So Sylvia the artist is very versatile, as you can see the variety of styles and approaches that she's tried. Here's another one which is completely different from what you've seen before, and this as well. I really like these as well. Now people might say, oh, it's MS Paint or whatever else, but I don't look at it that way. I look at what the content and the kind of things she's trying to say with these with these little works. Even this one is one that I really liked a lot. I love the color combinations and the kind of very block-oriented work that is being shown. And this is another one I really liked a lot. This banner, I don't know this. Dr. Sylvia can see it, but again, showing her ability to see a vast variety of people, and how all these people come together to sort of make the fabric of our country, of humanity as well. It's not just one kind of person or one segment of society that sort of determines how the whole of society looks or feels. There are all these people involved. And then, of course, going into very abstract, work. Of course, back again to more this thing. I really like this as well. This is something that you've used, I think, for a poster as well, right, Sylvia?
Yes, I think for 1 billion rising.
Right, and this one during the time of NRC and
yes.
if anyone can remember that, yes, these things just happened a few short months ago, but it feels like it was a lifetime ago. And this is one of my favorites. My wife and I love this piece, and hopefully someday we'll see it in real life as well.
You can have it. Yeah, I find it.
So yeah, so we're ending the little segment that we've shown Dr. Sylvia's artworks here. She's told us about her approach and her approach to her art as well, and a little tidbit that even I didn't know, that she was supposed to become an artist, but then ended up becoming a doctor. Luckily, she didn't go the route. She wanted to become. Luckily, she didn't go the route of another rejected artist. We all know that story. The most famous rejected artist of all time, and what he ended up doing. Luckily, Dr. Sylvia has done something extremely positive and helpful with her life, and not what the other man did. Let's not even mention his name in the same breath. So, getting back to the interview, I have just one last question for you, Doctor, and finally you can go back to your actual work. What brings you joy and satisfaction?
Joy and satisfaction. I mean, I think art does help me. It helps me a lot. And I have like a collection of music which nobody else likes, but I like playing it out loud on my
What kind of music?
speaker. So I have a combination of Kannada, Tamil, English, things that I've listened to growing up, and I mean they all have some association or some memory of something I dream of or something I memories with it. So that the music part really helps me, and writing also helps. It, it helps me, and I do like I'm not a religious person, but I do try to meditate and not jump in from one issue to another. I think it's important to take time off, and so when people tell me I'm very busy, then I actually realize I'm not that busy, that I'm just like a headless chicken running from one issue to another. Because I think that kind of makes one, keeps on elevating one's own whole importance in the larger scheme of things, and one doesn't take a back step and say, actually I play this. This is just my role for this moment. So yeah, I think, and I used to read a lot, but now it's kind of taken a backseat.
I mean, of course, Dr. Sylvia is being very modest. She definitely does not run from issue to issue like a headless chicken. There's a very considered approach to the way she does things. But having said that, she goes very deep into the issues that she works in. So she has a lot of communities that she interacts with, a lot of different people from various backgrounds, people who are, I mean, like I've mentioned before, right from researchers to other doctors and other things, and also a lot of tons and tons of reading that she does in the course of her work. So I know that there are a lot of time definitely goes in in all these efforts, as well as going and interviewing hundreds and thousands of people like she has. So she's definitely a standing example for a lot of people like me, and hopefully for a lot of people out there as well. I think it's not just other doctors or people working in the specific areas that she's working in, but a lot of us working in many other areas where we are interacting with people who are vulnerable, in order to look at what we can do to provide them platforms so that they can speak for themselves and determine their own course of life and action. So all these things are very important. We have learned a lot from you, Dr. Sylvia. Thank you so much. I know I've learned a lot. So I really appreciate you taking the time to talk to me and to spread this knowledge. Hopefully, it will stand the test of time, and people will be referring to your wise words for many years to come. So thank you so much, guys. Like I told you earlier, this is Insight. It's a free, open source online knowledge bank where you can come and access it whenever you want. And it's also, of course, a collaborative interview series. I'm Hari Adivarekar. I'm right now the one-man show. I have a lot of help behind the scenes from various people, but ultimately the buck stops with me, and I'm the one getting this all done. So if you'd like to check out more, go and check out my website adivarekar.in/insight. I'm also putting this up on YouTube and Instagram and Facebook. So there are a variety of platforms that you can access this information on. You can also access all Dr. Sylvia's writings, her artwork, and her fiction writing as well, which you should read. It's very sharp and very funny. You should check it all out on her blog. The link will come up soon on the screen. So guys, thank you so much. And thank you so much, Dr. Sylvia. I hope that we get to meet. Please.
No, I want to tell you that having a space like this is really important. And like you helped me also to kind of look at myself, to think about myself, and have a little more understanding about things. Look at my art with like fresh eyes. So thank you for that. Much appreciated.
Thank you so much, Doctor. Have a wonderful afternoon, and all of you remember to take care, stay safe, and be kind to people around you. Thank you.